So let's start with this first case. So 2026, underline VUMC, underline BL1. So we have this 74-year-old gentleman with hypertension, hyperlipidemia, type 2 diabetes, presenting with shortness of breath. Again, these images here, these are like AI generated. It's not like a real patient. Just full disclosure here. So let's open up the case. This case should be pretty straightforward, but it's going to set up our talk for FFRCT, right? So the first thing we do here is, looking at the axils, we can just double click. So it's going to be big, and you can either press on F4 or you can do the MIP, here. You guys learned how to do that, right? And what we're going to do is we're going to just scroll down, here. So we're starting at the left main, and his left main bifurcates, actually trifurcates. There's like a tiny little rainbow, looks like here, right? But then you have a lot of calcium here, a lot of calcified plaque at the LAD, right? So as we go down, as you keep scrolling down, and then the LAD gives rise, to this medium-sized bifurcating diag. And as that keeps coming down, the LAD reaches the apex, doesn't wrap around the apex, reaches the apex. Okay, so far, we're going to go back to that. There's like a lot of junk, here that we're going to go back to that. And then here, we have this diag, that also has, it's a medium caliber diag that also has, some plaque, over here. We're going to go back to that too. We're just mapping. And then as we keep scrolling down, now we're going to follow the circ. As we keep following down the circ, and then we get to the mid sinus, area, we can kind of, see that both the circ and the RCA, they're pretty sizable, here. So this might be a co-dominant system, but let's see. So as we kind of go down here, we see that the RCA gives rise, to the PDA and to this like, PLV. It's like a dual PDA, looks like it, right? And the circ, gives rise, to some posterolateral OM branches, So I guess we can call this co-dominant, system or balanced, system, right? So the circ, doesn't have anything exciting going on, but let's take a look at the RCA. So the RCA has a little bit of calcified plaque at the proximal, but you can see the lumen really well, even on MIPS, so it tells me that it's probably okay. And as you keep going down here, the rest of the RCA is pretty unremarkable, okay? Now we need to go back and take a look, at this LAD. So for that, we can go back, if you click F3, or if we click here and go to the MPRs, we're going to go back there. And we're going to click on one of the curve MPRs over here. I'm just clicking on the LAD one. If it doesn't give you the LAD right away, you can just go down here. You're going to find the LAD. If you click on the mid mouse button, you can zoom in. So as I see the LAD over here, I can hold shift. And then you see that the mouse changes. So this is without shift. This is after I hold shift. So the mouse changes. And I'm just going to click here, and it's going to segment, the LAD for me. I need to see if those contours, if they're right. Doesn't look like it segmented correctly. So let me go find another. I'm just going to go to like a more distal area over here. I'm going to click it. And now it's segmented the LAD correctly, as I can see here. Okay. And taking a look, at this vessel, what do you guys think? We have this area of stenosis over here. And if we walk around, I mean, we can see the lumen, right? So that's a good thing, but it's dense, calcium over there. So who would vote for mild? No. Who would vote for moderate? Yeah, there's a couple of people moderate. Who would vote for severe? Yeah, there's kind of divided between moderate, severe. And I agree, this one is kind of a little hard. We can check like the cross section here. And the cross section, I mean, again, it's an eccentric plaque, right? You can see the lumen. So that would favor kind of a moderate obstruction. Here more proximally as well, favors more proximal, more moderate, disease. One of the things is that there is a lot of calcium blooming here. So what can we do to reduce the blooming artifact? One of the things that we can do at the scanner, if we have the raw files, is we can reconstruct the images in a higher kernel.